because it's not about treating patients anymore. It's about what the insurance will pay for. And this is happening more and more, and it's literally destroying all of healthcare. And this is why you see, physician suicide rates so high, because, you work so hard to go through all the training to become a medical professional, only to find out that instead of being able to treat people, you spend your time dealing with an insurance company who is dead set on using everything, including the latest, technology, to essentially scam you or the system out of your payment. All right, welcome, medical entrepreneurs. Thank you so much for joining me today. Today we have a topic that we all love to hate. We're going to be talking about insurance companies and their increasing role in healthcare, and how insurance companies are destroying our healthcare system, decreasing the quality of life of those who choose them to be their insurers, and also some of the most recent developments in what insurance companies are doing to harm practitioners and physicians, and basically how they are becoming more and more powerful and using technology against the healthcare system in order for them to make a profit. So to start off with, I just wanted to kind of start off with a little bit of history of like where these insurance companies came from, and even go back to a time where most of us probably were never aware of this. But can you imagine at one time there were corporations who actually contracted with hospitals and physicians to provide healthcare for their employees? If you can imagine such a time where basically you had companies who were so interested in caring for their employees that they would either hire physicians and staff, or would contract out to them to basically provide care to their employees. And at this time, physicians could actually make a decision as to what was best for the patient, and the patient and the physician could make a decision together. And then based on the physician's recommendation, that care would be delivered and it would be paid for by the corporation. After probably several years, there was essentially this push for what's called managed care. Some of these companies came in and said, hey, we know how to manage things better. And if you hire us, what we're going to do is we're going to be like a gatekeeper of the healthcare. And because we're a gatekeeper of the healthcare, we're going to be able to decrease the cost of the healthcare. Unfortunately, ever since insurance companies got involved in healthcare, the actual healthcare costs have actually gone up. And part of the reason why is that it's estimated that 51% or 51 cents out of every dollar spent at healthcare actually gets trapped into the administration cost of healthcare, meaning that for every dollar you pay for healthcare, 51 cents of that or more gets trapped in the bureaucracy of the healthcare administration. And you can see the graphs of this as if you ever look at a graph of people, they show like the graph of the number of healthcare administrators over time, and the number of doctors. You can see the number of doctors is like slowly increasing, and the number of healthcare administrators like a spike. And so basically now what we have in our system is we have essentially healthcare corporations or insurance corporations that have become so large and powerful that they literally define what healthcare is, and they themselves set the standard of medical practice, which is illegal, but they do. Let's go ahead and dive in and look into a little bit more. One of the things that I think we should all recognize is just how dangerous healthcare insurance companies are. A couple of things you may not be aware of is that healthcare insurance companies have very, very large budgets for lobbying, and they're highly connected to the government. And in fact, most of the things that the government does, for example, the Affordable Care Act, Medicare extensions and expansions, those are almost always more profitable for the healthcare insurance companies, and they're usually not beneficial to the patients or the physicians. One of the things that healthcare companies and insurance companies are really good at is essentially building systems to not pay for healthcare. And you can see this, very clearly. Like, for example, it's common practice for most healthcare insurance companies to take away 10% of any claims that you send in and immediately trash them. So, back in the day when you send in claims via, mail, they would literally just throw those away. Take 10% and just throw them away. Don't even look at them. Don't process them. Now that it's electronic, they don't process them. They claim they never got them, that kind of thing. And that is legal. It has actually been challenged in court, and it still remains legal because of the power that these health insurance companies have. And so basically, if you're a provider, you have to realize that 10% of your claims that you send in will automatically get lost or get delayed or get denied for any number of reasons, just because they know that statistically, if they keep doing that to more and more people, that there is a certain percentage of people who will not refile those claims, and they will not have to pay for the healthcare of their beneficiaries or the people who basically hired them. I think that alone kind of says what kind of business these people really are in. The reality is that healthcare insurance companies don't really care at all for the patients. You can see this in their decisions and their algorithms that they use. You can see it in all the red tape that they apply. I mean, if you talk to any physician or any healthcare provider, in the last 20 years, you can see that it's been a significant increase in the amount of red tape and bureaucracy that you have to go through on a daily basis to get medications for your patients. Even generic medications, many times you have to actually go through and end up talking to someone who has no idea what they're doing, somebody who has no training at all, and you're sitting there trying to justify to them why your patient needs a certain procedure or medication, etc. The reality is that they know very well that you have the right to essentially order these. You have the medical decision making ability to make these decisions, but they also know that the more time that they can put you in front of somebody else who has the ability to basically deny this or has the ability to slow it down, that there's a percentage of people who just won't do it. And I myself, when I had my insurance-based practice, which I left many years ago, I was also a victim of this because I started to realize that the insurance companies were playing a game, and the game is a financial game that they're playing. They understand that basically if you have to hire someone to get on the phone to authorize medications for a patient every month, that is going to cost you some amount of money. So they understand that basically you have to essentially spend your time and your effort and your money to essentially go and hire someone to call these insurance companies, fight with them about medications, fight with them about procedures. And then on the back end, you're going to have to hire a billing firm or have to hire multiple billers yourself to essentially fight these claims just for you to get paid. And they also understand that the more that they can make you spend, that the less likely that you'll be able to fight with them. And so this is why, what I saw personally firsthand was that initially, probably around, say, the late 2007s, that kind of thing, most insurance companies weren't terrible. They were annoying on certain medications that were expensive, on certain procedures that were expensive. They required you to jump through some hoops, and it wasn't terrible. It was, pretty rare. Then over time, this drastically increased because what people don't realize is that the health insurance companies are essentially data-driven entities that are using advanced analytics, the same way that Google might use analytics to determine what you search for. These health insurance companies like Blue Cross Blue Shield, United Healthcare, Aetna, Humana, these companies like this, they actually pool all their data and they work together with each other, by the way, to basically find ways to essentially deny payment for therapies, deny payment to providers, and anything they can do essentially to basically not pay you or anyone else in the healthcare chain. And so what you see now is you have massive amount of turmoil going on in healthcare. So for example, here in North Texas, a very large nonprofit chain known as Texas Health Resources actually walked away, completely eliminated their contract with Blue Cross Blue Shield Texas. And honestly, I think this is for good reason. Blue Cross Blue Shield Texas has become completely malignant here in Texas. They're probably one of the worst examples outside of United Healthcare of a company who doesn't care about their customer, doesn't care about the provider, doesn't care about people getting injured, hurt, or damaged by what they do. They themselves have become extremely malignant, and I would even say have malice in their actions. Just to give you an example of how far Blue Cross Blue Shield has actually gone here in Texas, I've actually been an expert witness in several cases where Blue Cross Blue Shield themselves has actually taken one of their subsidiaries and have basically gone through pharmacy data. And if you were a doctor who prescribed medications that were considered to be expensive at the time, this third party that they wholly own would go and file a medical board complaint against you, that you would have to defend, saying that you were part of a racketeering scheme to basically bill insurance and part of some kind of pharmacy money making scheme, and that you were involved in illegal activity. Now, this health, like with the medical board complaints, in case you don't know, whenever you get a medical board complaint, it has to be investigated 100%. Like even if somebody totally insane makes the complaint, and apparently in this case, even if a corporation owned by a health insurance company makes a complaint, you still have to defend it as a physician. And the cost to defend such a thing is roughly in the range of 5 to 10K. And that's for small things. If it's bigger, it's going to cost more, right? So what they do is they find people that are actually prescribing medications that their patients like, medications that may be expensive for the insurer to pay for. Once again, the healthcare provider has no idea what deal the insurance company has made with the pharmacy or with the manufacturer of that drug. As physicians and healthcare providers, we're not privy to that information. I have no idea what rate Blue Cross Blue Shield negotiated for some kind of medication. I don't know. But apparently, if you do that and you're considered to do that a lot, then the Blue Cross Blue Shield subsidiary will file a medical board complaint against you, and you will have to defend it to the tune of $5,000 to $10,000. That is how far they have gone. They have obviously treated hospitals very poorly, coming back to hospitals and telling them that surgeries that had been performed successfully were not done correctly, and that all the money had to be returned. This kind of stuff. Basically, just essentially doing anything they can to rake back as much money as possible, and essentially hurt the people providing the healthcare. I think this is a good time to also talk about some of the more interesting things that are going on with the healthcare insurers, because what's happening is you're getting to see that there is a convergence in the healthcare insurance. There's only a few healthcare insurers anymore that are out there, and they're all getting quite large. One of the largest healthcare insurers and one of the most dangerous healthcare insurers is United Healthcare. United Healthcare, not only do they provide healthcare insurance, and they're also a management organization for healthcare insurance, but they have probably the largest leading edge, essentially technological foundation for essentially finding ways to not pay for services that are rendered, finding ways to deny patients for services that they probably need, and finding ways to just in general screw over everybody else except for them. Just to give you an example, I was fortunate enough to work in a company where we'd actually hired someone who was part of United Healthcare who had left. And I worked with this lady for I'd say about 8 months. And one of the first things I did is I sat down and said, like, hey, explain to me how United Healthcare works. And what was described was extremely shocking. And I just want to share it because it kind of opens your eyes to what you're really dealing with. If you're an independent doctor, if you're an independent, practitioner, and you're taking healthcare insurance, you probably need to understand what they're really doing to you and what their intentions are. Because a lot of us start out in medicine thinking, oh, well, I'm just going to sign up for all the insurances. And then that way, any patient that comes in, I can take their insurance and help them. The reality is that that's probably one of the worst moves that you can make with regards to your business and making sure your practice can stay afloat and survive. Part of the reason is because of companies like United, who basically will go through and try to find every contract that you have ever signed as a practice, and then make a deal with those contractors to get the lowest price applied to all the network. So say, for example, you sign up for United Healthcare to treat United Healthcare patients, but you also sign up with another insurance company, maybe one that's like less reputable, something like Molina Healthcare, right? This is another insurance company that's out there and then notoriously difficult to deal with, very notorious for not paying, very, very sketchy company, right? And so basically, one of the things that happens is that United Healthcare will contact that insurance company and say, hey, we noticed that you have a lower rate for physicians. Like, you're only paying the doctor maybe a third or 30% less than what we're paying. Here's what we want to do. We want to make a deal with you so that we can pay your rate. And so what will happen is they will find whoever you signed up with that has the lowest price and then make that rate their rate. And so what ends up happening is that you end up cutting your reimbursement significantly, because if you made the mistake of taking an insurer because maybe you had a patient who had that and you're like, oh man, I really want to help this patient. I know they don't pay that well, but there's only one of them. So I may not make that much money off this guy, but at least I'll get to help him. And then the other people, I can treat, and they'll still be, profitable for the practice. What ends up happening is that you end up getting that lower rate applied to all of your insurances, and then you end up making significantly less money. And what ends up happening is that your practice starts to really falter, and that's where a lot of people are. When I talk to a lot of physicians out there, they're complaining because they're saying, hey, I'm working harder than ever before. I have more red tape than ever before. I'm having to make calls, having to deal with, peer-to-peer reviews on basic stuff. All this stuff is taking my time and is costing me money, and I'm not getting paid for it. And so what ends up happening is that you basically become unprofitable. And then most of these physicians just give up and they end up working for a hospital, and they get burned out. And that's why you see these angry physicians that are out there who kind of hate the world and hate their life. It's mainly because of healthcare insurance companies that have destroyed the system of healthcare, because it's not about treating patients anymore. It's about what the insurance will pay for. And this is happening more and more, and it's literally destroying all of healthcare. And this is why you see, physician suicide rates so high, because, you work so hard to go through all the training to become a medical professional, only to find out that instead of being able to treat people, instead of being able to help people, you spend your time dealing with an insurance company who is dead set on using everything, including the latest technology, to essentially scam you or the system out of your payment. The healthcare and insurance companies are also very well connected into politics. They spend millions every year on lobbyists. And so, essentially, they're somewhat untouchable in many regards. You can sue them, but I mean, if you try to sue a company like Blue Cross Blue Shield, good luck. They have hundreds of millions of dollars. They could sustain a lawsuit for decades. Most people can't do that. And so because of that, you end up losing out. One of the things that this lady also told me from United Healthcare was that they were using advanced artificial intelligence to determine how to deny claims. And what they were basically doing is they were trying to find claims that they could deny no matter what the cause, like it's not based on any logical reason, but basically just claims that they can deny that would have the least rate of recurrence, is what I think what they called it, or basically have a least rate of people trying to fight back. And so what I saw firsthand was that many times what happened with insurance companies is they would go through your claims and they would find little charges, and they would deny those little charges, like $5, $3, $8, $20, like these little charges, because by the time you hired an employee to go and fight that claim for you, what ended up happening was that you ended up paying that employee more than what that claim was worth. And they just kept doing this over and over until they could just bleed you out, until you basically just couldn't tolerate seeing any more patients. And this is what's causing the healthcare system to collapse. And this is why I tell people, like, hey, you've got to get out of the mainstream healthcare system. It is a losing game. You are fighting people that are way bigger than you. They have no regard for human life. They have no regard for their own customers. They consistently have proven over time and time again that they don't care about the providers in their network. They don't care about their patients in the network, and they're there to make money. That's their bottom line. And you can see it in their profit statements. You can see what they do. When you have companies like United Healthcare that have artificial intelligence algorithms that are essentially designed to maximize profit at all costs, no matter what happens to patients, no matter what happens to human lives, is that really a healthcare system? Or are these more like gangsters who are essentially raking in profits while they hurt other people in the healthcare system? I would argue it's probably the latter. The other thing that one of the things that I saw a lot was a lot of times what would happen is that, say, for example, you had a lot of patients that were United Healthcare, and you started to figure out something that worked for those patients. So say, for example, you had a company and you have your own practice, and you notice like, hey, this large employer has United Healthcare. Why don't I go to that large employer and offer some kind of program to help their employees? I think it's pretty reasonable. A lot of times people that work in a certain line of work, they often have similar issues medically. And then if you can offer a solution that can help benefit those people, not only do you do well for it, but also those patients get better. And in general, the company gets better because their patients are healthier and happier. Take, for example, if you went to a technology company where everybody worked on the computer and they all sat in a desk, and they many of them had back pain and these kind of things from sitting for so long. Many of them have eye strain from all the monitors and glare, et cetera. And you found a solution to help those people deal with that. What would happen is that United Healthcare has algorithms that would identify you as somebody who is doing a lot of a certain type of procedure and would automatically flag you for suspicion. And the first thing they would do is they would begin an audit path. So initially they would go and they would start requesting records. And while requesting records doesn't seem to be that annoying initially, what can happen is that they can start to request large volumes of records in very short periods of time, which is traditionally what they do. They'll send a request for records. They'll say, hey, I want these, 300 records of the 300 patients, and I want them for an entire year. Every visit for last 12 months on 300 patients. So then you got to have staff that you pay out of your pocket to go dig up all these records, get them organized, make sure you got everything right, transmit them to the place, make sure the place actually received them. Another game that they often play is, you'll send the records and they didn't receive them, even though you have a fax showing, hey, they arrived. They'll play this game a couple times just to waste your time and basically burn out your resources as you're trying to deal with them. Just for the hope that you'll just give up, and then they can basically take all the money that they paid you back, or at least a chunk of it, just to basically make more profit on their end. But then by the time you do provide those records, what they do is they'll start to use those records and they'll start to look for anything that they can systematically deny. So for example, if you get really good at doing a procedure, like maybe you become the top knee surgeon in your area, and all you do is a partial arthroplasty. So you're doing a partial knee surgery. It's kind of a new procedure, and that's the thing you want to focus on. And you just want to do that one procedure until you become the best in your area at that. Most people would consider that to be very good as its way of specialization. And that way in society, we have somebody who's an expert at this one procedure because they do it so often. Well, the insurance companies will identify that as highly suspicious because they will say, hey, you did so many of this one procedure and other people with your same specialty didn't. You're now an outlier, so you warrant more investigation. So we're going to pull more records from you. We're going to put more people on you. We're going to try to find ways to deny more of your stuff. We're going to look for any gap that you have in your documentation, whether it's real or not, doesn't matter, because you're going to have to fight it either way, and it's going to cost you a fortune to fight it. And this is what they do. They basically intimidate and hurt you, and basically anybody who becomes a very tight specialist in what they do is automatically flagged for analysis. The other thing that they're really good at is basically making deals with other companies to eliminate many of the things that would traditionally add value to your visit as a healthcare practitioner or somebody who owned a clinic. So as you know, basically healthcare reimbursement has not been increased since probably since the 80s. When you think about it, basically back in the 90s, many of the things that were paid for in the 90s are now, even though inflation has occurred over this period of time, even though the value of the dollar has decreased significantly. I mean, just imagine if you were in the year 1999, what $20 was worth back then versus today. It's significantly different, Back in 1999, $20 could buy you an entire meal somewhere. Today, $20 can buy you maybe some fast food somewhere. It's a completely different situation, right? But the thing is that if you look at your reimbursement in healthcare, it has not increased with the cost of living, is not increased with inflation, and if anything, they have actually been cut. And so what you're seeing for a lot of people, and this is what I tell a lot of my doctor friends who are struggling, is they come, they say, I don't understand. I'm working harder than ever before. We're seeing more patients than ever before. We're busier than ever before. We're requiring more staff, more overhead. We have to have more people. Our billing team is now, 12 people just to deal with all the BS that's going on with billing and all the authorizations and all this kind of stuff. And we're making less money. And at the end of the day, I'm working harder and harder, taking home less and less. I spend less time with my family, and I earn less every year. And the reason why this is happening is that the rates that you're getting reimbursed are basically fixed. And even though if you look at the recent years, you can see that inflation has been roaring. The reality is the government way underestimates the inflation rate. They say that it's 8%, it's closer to 15%. But even if you assume that you split the difference, you say, hey, it's 12%, or maybe you say it's 10% for easy math. If you go for 3 years at 10% inflation and you don't have an increase in your reimbursement rate for a procedure that you're doing, that means in 3 years, you have been cut effectively by 30%. The amount of money you may receive may be the same, but its purchasing power is now 30% less. So you basically have had a 30% pay cut because of that. Don't forget also all the additional costs you're now incurring because companies like Blue Cross Blue Shield, United Healthcare, Aetna, Humana, all these insurers now have even more red tape for you to go through. Hey, you want to do that surgery? In the past, it wasn't a big deal. You could simply send in an authorization and be done. Not anymore. Now you got to send an authorization in. You got to send the medical records in 1 to 3 times because maybe they get lost. Big surprise. Hey, 10% of them get lost every time. What do you know? Sounds very familiar, right? And then by the time that you do all of that, then you have to go have a peer-to-peer with a quote peer who's not even in your specialty. The last time I had a peer-to-peer for a patient, I had a peer-to-peer regarding spinal surgery, and it was with a pediatrician who had never done spinal surgery and had never been in spinal surgery and had never studied spinal surgery in his training. And he told me that as well on the phone. This is the kind of stuff that they're doing. And it's basically a total farce and it's a total fraud and it's destroying the healthcare system. And so that's why I think it's very eye-opening. And I wanted to make sure and make this video to let people know that, hey, if you're a practitioner in healthcare and you are currently seeing insurance-based patients, you need to do everything in your power to get away from that. You need to start offering cash-based services. You need to start offering other things that you can charge for, because the longer you are connected to these companies, the longer they will come and they will destroy your business. Their methods are very simple. Their methods are very calculating. It's the same thing that was done in the past with auto part makers and the car manufacturers. A long time ago, what happened in Detroit was that the car manufacturers like GMC and these kind of guys, Chrysler, all these kind of guys, what they would do is they would go to their auto part manufacturers and they would say, hey, part of our new quality control is we need to see how much you're paying for the raw ingredients that go into the parts that you sell us. We want to make sure that those ingredients that you're using are high quality, or whatever excuse they gave. But basically what it did is it gave them the numbers and it gave them the margin of the auto part manufacturers, because they could figure out like, hey, if this guy is paying, $1,000 for the part and he sells it to me for $1,500, then he's making $500. So I know that I can squeeze him $400 and he can still make a profit. And then basically I can take that other $400 from me. And this is what they did. And that's why, you can see, what happened to many of the auto part manufacturers in the United States. They are no longer in business. And this is what's happening in healthcare. You have companies like, even Medicare does this with regards to like what's called durable medical equipment. In order to submit a durable medical equipment bill to Medicare, you have to have not only the place where you got it from, you have to have the invoice, you have to have the packing slip, you have to have the shipping manifest, all of that to give a patient a back brace. Does that really make sense? No, it doesn't. But what they're doing is they're trying to collect that data so they can eventually say, hey, we noticed that you made this much money on the back brace. So now what we're going to do is we're going to cut that reimbursement over and over until it comes to a point where you won't give out any back braces, because it will cost you money to give out back braces. So who really loses? The provider, but most importantly, the patient does, right? And so this is what these companies are doing over and over through more and more mechanisms. And with technology, it's only accelerated their rate of growth. One of the things I also wanted to talk about briefly with insurance companies is a lot of times what we're seeing in many cases, and many providers are dealing with this, is we have, of course, a larger population of older people that are coming every day, right? So if you look at statistically, demographically, the number of people that are retiring, the number of people that are going over the age 65 is increasing significantly. And so for many of them, they are offered Medicare. And the whole Medicare system is essentially it is probably the worst thing I've ever seen in my entire life with regards to how people get Medicare and the confusion that goes around it. So typically, if you know somebody who is 64 and a half or somebody getting close to 65, they will be bombarded with phone calls, text messages, postal mail, you name it, postcards, like anything they could ever do to get in front of these people and they're basically being bombarded by people who are selling insurance that is supplementary to Medicare. And so many of the times what happens is that someone can have Medicare coverage, and if they buy a secondary insurance, so for example, maybe they have Medicare primary and their secondary insurance might be United or Aetna or whatever, then that secondary insurance will then control their primary insurance. So I've seen many times patients who have the ability to receive a treatment based on their Medicare guidelines, only to find out that because they paid extra supplement because they paid extra money for a supplementary insurance, that now that supplementary insurance denies the coverage for their Medicare. So literally, they could have had a procedure with Medicare, but because they actually paid extra, because they did what they thought was right to make sure they had extra coverage, they now get denied those same treatments. And you can find so many stories of, heartbreaking stories of people who, for example, had cancer and they wanted to go to MD Anderson for treatment, and Medicare covers that. But then they made the mistake of signing up with a secondary insurance, and then the secondary insurance says, no, we don't cover MD Anderson. You got to go to this other place that doesn't have a good reputation because it's cheaper, and we made a deal with them. And this happens over and over. And so I think what's happening in healthcare is you're going to see, like you do in most countries, where you have essentially a government healthcare system. And in our case, we basically have socialized healthcare now. I mean, when you really look at it, what a lot of people don't realize is that they think, oh, socialized healthcare like Canada or England or any of those things, all of which, by the way, have essentially imploded and failed. But basically, somehow some people think it's great, and they keep talking about how it's going to be excellent because the government always does so well on everything they do, right? The government's known for efficiency and making things work. Yeah, right. So basically, they'll have essentially a government insurance. And then what will happen is that they will end up getting a secondary insurance that will block their coverage of whatever the treatment is that they need. And so in a lot of cases, they have no idea this is happening, and they're trying to do the right thing only to find out they get denied. One of the other things I've also seen with a lot of the insurance corporations is that they also, if you look at many of their ads, they also promise a lot of things to people only to find out that many times they don't do anything. One example of this was Humana. Humana for a long time had a deal where they basically provided a nurse or an RN who would call the patients and check on them, which at first, look, that sounds great, like obviously having a nurse that would call and check on patients and make sure they're okay, make sure they understood how to use their medications, make sure they got the appointments they need to follow up. Like that seems like a great thing, right? The only problem is that it didn't work like that. In fact, if anything, that nurse actually denied more things than they could. And so what they found was that the nurses that essentially were the most helpful for patients were actually those that increased the cost of healthcare because they're trying to help the patient. And instead, they wanted nurses who actually decreased the cost of healthcare or told them, hey, you don't need to do that, or hey, you don't need that medication, et cetera. And many times it didn't work out well for the patient. One of the other things I just wanted to mention regarding health insurance is that if you look at the average cost of health insurance in the United States, it is people pay a significant fortune for it. It is extremely expensive. Most of the patients I talk to, they pay in the range of $1,000 to probably $3,000 a month in healthcare insurance. And when you look at the cost of such a thing, I mean, it's absolutely unfeasible. And when you look at it, like I know, for example, for myself, like until the recent things I've discovered about Blue Cross, I used to be part of Blue Cross. I used to pay Blue Cross, and like for a family of three, we used to pay $1,400 a month, and we never used it. We never had any health conditions, thank God. We never had any issues. We never took any medications, never even used it at all. But yet, if you roll back in time to the year, 1999, you could have single coverage on one person for $300 a year. What changed? What was the difference? And you got to ask yourself, why is this happening? Because when you look at the premiums that the healthcare insurance companies are charging, they're through the roof. They're basically to a point where essentially it doesn't make sense for someone to actually carry health insurance many of the times. Perhaps for catastrophic coverage, like if you do have a heart attack and you need to have heart surgery, it makes sense. So pretty much only for catastrophic coverage do you really need the healthcare insurance, because most of the time the insurances actually are harmful to you. The other thing to realize is that the insurance companies make deals with the pharmaceutical companies and the pharmacies. And so, for example, if you go into a pharmacy and you say, hey, how much is this medication? And you tell them that you have insurance, they have to provide you a different price than if you came in with cash. So they literally will increase the price because you have insurance. It just doesn't make sense. The healthcare system is literally falling apart because of this. And so I think for all of us, what we need to do is to stop relying on the healthcare system, realizing it is a slow ride to destruction. Basically, you can play this out. It's very simple. They're going to continue to keep the reimbursement rates the same as inflation continues to roar. And so in another 3 years, you will have another 30% cut. So another 3 years, what you'll have is roughly, if everything stays the same as it is now, you'll be down by 60% on your reimbursement. And at that point, it will become almost impossible for you to have a medical practice that is not subsidized by a large corporation who is making money through some other mechanism. And so this will be the death of most medical practices. And so most independent practices will go out of business because they can't, they don't have the capital, they don't have the money, they don't have the diversity of different services that are actually paying well to help cover the cost of all of the overhead required. Because just for example, if you try to start a medical practice on your own, the amount of work that you have to do is basically unfeasible for a single person to do. I remember a long time ago when I first got out of training, one of my friends started a medical practice and he started it completely on his own. He was the doctor, he was a receptionist, he did everything. And so while it wasn't necessarily the wisest thing, he was able to do it though because there was enough room that he could actually figure out all the stuff he needed to do and do it. Nowadays, that is impossible because just from the insurance requirements alone, just to deal with the pre-authorization, to get somebody's insurance card and then have to call up and verify that they actually have coverage, and then call and basically use the computer to figure out what their deductibles are and then calculate, hey, can they afford this? And if so, what do I have to charge them because it's not clear? I'm going to have to figure out like, what is their out-of-pocket expense? What is their deductible? What is it? What if they have an extra family member? How does that work? It's extraordinarily complicated. And you got to ask yourself, why is it like that? It doesn't have to be like that, but they do it on purpose because they know that the more that they can make things complicated, the more that they can basically take advantage of you. Now, this also, we talked a lot about private health insurance companies, but the publics are no better. Medicare itself is, sadly used to be one of the worst paying insurances. And nowadays, if you look at a lot of the Blue Cross Blue Shield, United Healthcare, these reimbursements, many times their reimbursements are actually less than Medicare. So they're paying less than the lowest insurance. It just doesn't make sense. I remember a time where you used to go to Blue Cross Blue Shield and you get maybe 140% of Medicare. You get 150% of Medicare. Nowadays, you might get 80% of Medicare, 90% of Medicare. Anything they can do to basically rip you off. So now, and keep in mind that Medicare, basically, you have to realize that we have essentially a socialized healthcare system. And one of the things that people don't realize is they think like, hey, socialized healthcare is like Canada and England, as I mentioned before. But basically, what they don't realize is that the way that the healthcare system is set up is that Medicare licenses a certain set of codes. The ICD-10 codes, for example, they're licensed from the American Medical Association. The American Medical Association makes a lot of its money from the licensing of those codes. And that's why when they rolled out Obamacare or the American, the ACA, was it Affordable Care Act, when they rolled that out, they basically went to the American Medical Association and said, hey, if you don't support us, we're not going to renew your contract and we're not going to use your codes anymore. We'll just make our own codes. And then you guys will be out. And they basically held that over their head until the point where they basically had every physician standing and clapping their hands about how great this affordable care system is going to be, which, as it turned out, was a huge disaster. Healthcare costs have actually skyrocketed since then. Healthcare insurance rates have skyrocketed. Premiums have skyrocketed. Providers have made less than ever before now. The amount of paperwork and red tape has been worse than ever before. It was probably the single worst thing to ever happen to healthcare. So thank you for that. But the reason why it was done was to continue to push a government-centric model to healthcare. The healthcare industry is one of the most overly regulated industries in the entire world. And to the point where it's basically, it's to the point where it's very hard to innovate or do anything new in healthcare, because essentially if you do anything new in healthcare, you are by definition not following the standard of care, because the standard of care is what everybody else is doing. So if you don't do what everybody else is doing, then you're different. And if you're different, then you're wrong. That is basically the way the healthcare system is organized. And so you can see this from the way that the system goes from the government down. So basically you have, the federal government who runs Medicare sets these codes that are licensed from the American Medical Association and says, hey, for this code, we're going to pay X number of dollars. And there's different parts of the country. So, for example, if you're in a very rural area, they're going to pay you less than maybe if you're in like a big city. So if you're in San Francisco, you're going to get paid a little bit more than if you're in Iowa. But roughly the rates are pretty similar, depending on the cost of living, but that's the rates that are set. The private insurance companies come in, they use the exact same codes, the exact same reimbursement model, and they say, hey, we're going to do the exact same thing. And in the past, they used to say, hey, we'll do 140% of Medicare, or we'll do 110% of Medicare. Now they're going to do equal or less than Medicare. So basically, the entire system essentially is defined by or controlled by the federal government. And this is why you find so many inefficiencies in healthcare and why you have so many issues. One of the things that is a major issue in healthcare is the use of testing and the use of diagnostics. Many of the private health insurers, such as United Healthcare, such as Blue Cross Blue Shield, these companies, they have in particular been very, very good at denying a lot of these tests. They come to a point where even just to get MRIs now is getting to be difficult for many people. The amount of documentation you have to submit to a third party. I remember just one time recently, it was probably actually a couple of years ago when I still did insurance. I remember I wanted to get an MRI for someone. It's very clear the guy had back pain with pain shooting down to his leg. Classic what's called radiculopathy. This is definitely warrants an MRI. Pain had been there for a prolonged period of time. All the stuff matched. I submitted the records. They all documented it, and it came back denied. I was like, what in the world's going on here? How can that get denied? And of course, if you wanted to appeal it, you had to go and do a peer-to-peer review. So I did the peer-to-peer review with some family practice doctor from wherever who's retired, and he got paid, I think, $15 to do peer-to-peer reviews. And he basically told me, he said that I have to deny so many of these, otherwise they won't pay me anymore. They won't give me any work. And so what happens is that these corporations, like these insurers, they will actually outsource these peer-to-peer reviews to companies who will then hire physicians to do these reviews at usually a very, very low rate, like 15, maybe $20 for an entire review. And depending on what it is, like if it's a surgical case, this could be, 100 pages of records. It could be a lot of records to go through, and they're getting paid $20. So you can imagine how much effort they're putting into this. To say it's very minimal. And then when you do get on the phone with them, if you can, which is sometimes difficult because for them, they're only getting paid $20. They have to make 2 phone calls to you. And as long as they make 2 phone calls where they leave a voicemail, that's all they have to do. So many times what they'll do is they'll call like real early in the morning or real late in the afternoon or during lunchtime. They try to call the most inopportune time where you were not going to be there because they want to leave a message and they don't want to talk to you if possible so they can just deny you. And then if they do talk to you, if you're able to get a hold of them, and the other thing to remember is they put these little timelines on it where it's like you have 3 days to talk to them. Well, the guy's unavailable. Maybe you're busy, you're running your clinic one day, you got the OR the next day. So you got 1 day you can call this guy during your busy clinic. And we try to call him, he's not there. You try to call again. Now you're seeing a patient. When he calls back, you can't answer the phone. And now you didn't get a chance to talk to him. But should you be able to talk to him, basically you have to present your case, and essentially it comes down to the point where, they're going to try to deny it as much as possible and try to avoid talking to you. And so this is also driving many, many denials. And this is also driving many people to come to a point where they're just tired of dealing with insurance. I can't tell you how many patients that I have now that come to me, they pay cash. They don't question it. They're happy to pay cash. They're satisfied to pay cash. They're happy to even wait in line to pay cash. And the reason why is because they have been jerked around by the mainstream healthcare system so much that they're sick of it. They're tired of getting substandard care. They're tired of having an insurance company who doesn't care about them at all, or a gigantic government agency who doesn't care about them at all, deny them basic, what we would have considered 20 years ago to be basic standard of care, denying them for reasons that are basically illegitimate. And so what's happening is that there's a whole market of people that are now coming into medicine, and they're looking for cash pay alternatives. They're looking for any alternatives. There's even new insurance companies that are starting up that are not like United, that are not like Blue Cross, but instead are like communal organizations where they pool all their money to basically treat people in a certain way without having to do these denials and these kind of things. Many times they're based on religions or based on churches, but those are out there as well. There's many people that are, essentially searching for doctors who are not part of the mainstream medical system, because they have come to realize that essentially, unless the pharmaceutical companies want something to happen or the insurance companies want something to happen, it's not going to happen. One of the things that I think is probably kind of like a good kind of story, or a good kind of, I always say, like, I guess, canary in the coal mine kind of situation, was recently I ran across a registered nurse here in Dallas. This registered nurse was making somewhere in the range of around, like, I think it was like $550,000 a year. This was an RN. She had previously worked in a hospital where she was essentially working on like one of the floors, like one of the inpatient floors. And she was assigned a lady who was had some issues, like she was psychotic and had a whole bunch of violent tendencies and these kind of things. And basically, this woman didn't like her as soon as she saw her, and basically ended up breaking something and took like a shard of whatever she broke, and then tried to cut this nurse. And the nurse ended up running down the hall, the patient chasing her. They called security, but you know how it is. There's only so much security for the hospital. So by the time security responded, it was like 15 minutes later. And this nurse essentially was like basically fleeing for her life because this lady was going to kill her. The next day she reported to work. The hospital assigned her to the exact same patient who she almost died from. And she said, "Hey, forget this. I'm out of here." And she went into aesthetics. She immediately studied how to do Botox, filler, these kind of things. Basically started out initially working with another doctor doing aesthetics in a med spa, and then ended up building a large client list, and then ended up building her own place. And probably, in the span of, I'd say, about maybe like 6 to 7 years, ended up going from, making better money than she did as a nurse to basically making well over the salary of a neurosurgeon. Because I know a neurosurgeon here in Dallas who actually makes less money than she does. And so this lady here, who's an RN, basically makes more money than a neurosurgeon did, probably to the effect of maybe 14 years less training than the neurosurgeon, roughly, maybe more. But did 14 years less training, let's just say that's the case. And then on top of that, she takes no calls. She doesn't work on most weekends. Some weekends, some Saturdays she does work. But that's usually because she missed a day she may have been off for like a vacation or something. So pretty much, 9 to 5, Monday through Friday kind of schedule, with no call. And then here you have a neurosurgeon who has done an additional 14 years of training, who is taking call Q3, getting paged essentially every single day for anything going on with any of his patients, and basically making less money than her. And the reason why I wanted to bring this story to your attention was because a lot of people forget that they think the reason why they get paid for something is because of their skill level or even their training. But it's not that at all. It's actually having to do with how you serve the customer and how many ancillary things that you can profit from during your ability to serve that customer, serve that patient. And so for the neurosurgeon, because he's a neurosurgeon, he works in a hospital, and the hospital makes a very large profit off of his work. As you might imagine, they bill for a neurosurgical OR, which is very expensive. They bill for the staff for that. The rep, the surgical rep who provides, hardware that the neurosurgeon uses and some of the technological things a neurosurgeon uses, that rep probably makes more than what most doctors do. And the neurosurgeon makes no money off of that. The people in the operating room get paid very well for their time, but they're all employees. And so a lot of times when you look at an average situation for most surgeons or physicians, what you find is that surgeon who is in the OR is taking 100% responsibility for everything. They're responsible to find the patient. They're responsible to diagnose the patient. They're responsible to figure out the patient's insurance to see if they can even have surgery at the hospital. They're responsible to basically get the patient into the hospital to have the surgery. They're responsible for the surgery. They're responsible for the post-op care of the patient. They're responsible for a minimum of at least one visit, maybe more, depending on global periods where they don't get paid to see the patient after the surgery. They're responsible for that. They're also responsible for anything that happens to the patient during the care that they receive at the hospital. And of course, they're responsible for the patient after the care as well. And so when you look at it, here's the physician or surgeon carrying all the liability, and you have basically many times what I see, especially with orthopedic surgeons, is many times you have the orthopedic surgeon taking all the risk doing the surgery, and meanwhile the rep standing in the room playing on his cell phone is making the same, if not more, than the orthopedic surgeon. Does that make sense? No. And the thing is that because they have stripped your ability they've taken every little piece of your trade and have basically sold it off to someone else and allowed that someone else, that corporation, to make money off of you. You as the healthcare provider, you as the physician, are essentially the number one. You take full responsibility for everything. If anything goes wrong, it's your fault. If you have a surgery and you have a complication with it, it's your fault. If you're doing a surgery and the OR staff didn't, properly prepare something and there's an infection, guess what? That's your fault as well. You got to deal with it, and no one else will be there. It will be you dealing with it on your own time for free. You basically take all the liability and you essentially get a very, very, very small amount of the money that went into that healthcare treatment. Keeping in mind that probably 51% of that, of the dollars that went into treatment, get maintained in the administration of the healthcare. The remainder of that 51% goes to the hospital, to the rep, to the drug, to the pharmaceutical, or for the device manufacturer. If you ever want to see highly profitable manufacturers, you can just take a look at companies like Stryker, these kind of guys. You can see they make, very, very, very large sums of money. You pay for, the OR, you pay for all this stuff. And basically you, as the main person who is essentially responsible for all of it, get little to nothing. So that's why I tell you that being part of the mainstream healthcare system, they have it down to a T, and they have laws also that prevent you from doing any of those things. They claim that they're conflicts of interest, but somehow it's a conflict of interest for you to be you're still responsible for that. But if you were to make money off of it, you'd be a conflict of interest, God forbid. But hey, a third party corporation who has no morals or ethics, they can do that. That's fine. That's not a conflict of interest, right? But anyway, so you lose all of your ability to bill on all these ancillary products and services that are required for you to do your main procedure. And because of that, that's why the neurosurgeon makes significantly less than the RN, because the RN is able to sell skincare, to sell laser treatments, to sell, beauty packages, to sell even food packages, because, they're in a med spa, maybe people are trying to lose weight. They can sell all of this, and so they can make so much more money per unit time than a highly trained neurosurgeon who is trying to save lives. And it makes me sick to my stomach to think about it. But this is exactly what's going on in our healthcare system. Essentially, the more trained you are, the more specialized you are, the less likely you have any kind of business freedom to make any money, which makes you extraordinarily vulnerable to hospital corporations and insurance companies. And we know the insurance companies are after their bottom line 100% at any cost, even harming their own customers, which is amazing to me. But also to the point where you have essentially hospital corporations who have essentially designed traps for physicians to get them ensnared in such an environment. One of the things that I would see over and over, as some of you may know, I'm actually trained as an anesthesiologist. And so as an anesthesiologist, I would interact with many, many surgeons, doing the anesthesia. And what I would see is a new surgeon would come to town and they would get a 2-year agreement. And in the 2-year agreement, what would happen is they would get 2 years where basically they would have the ability to kind of build their practice. So the hospital essentially would cover the surgeon's salary, and the government actually gave them money for this, especially if it's in a rural area. The government would actually give them money to cover this surgeon's salary. And so for the first 2 years they joined the hospital, they were doing great. Many times they didn't have a full caseload, but they were still getting paid the same. After the 2 years, they put them on production only. And to me, production only is probably really the greatest violation of of ethics that is out there, because what they're doing is they say to the surgeon, like, hey, for 2 years, you've been making a good amount of money no matter what you did. And for most of these guys, they get out of training, they've been in training for a decade, maybe more. And they're just ready to have a good life, maybe they get ready to get married, have kids, they buy a house, they buy a car. Now they have all these expenses and overhead. And so then by year 3, now they're cut to where they're basically in production only. And so now they basically have to find surgeries, and a lot of surgery, in order for them to make the exact same amount of money they did in the first 2 years. And so what you find is either doctors that move every 2 years, and there's a lot of these, and there's many reasons why they move every 2 years, but one reason is financially. But number 2, you have doctors who actually stay in the same place because maybe now their family settled. And so what occurs is that they end up basically having to recruit cases and do more and more cases just to fund their lifestyle. And because of that, it becomes an unethical situation, because they're essentially trapped between two things. Do I do what's best for the patient, or do I do enough to pay my bills? And when the hospitals put them into this kind of scenario, it by definition is an ethical dilemma, because basically they say, well, I can either, if I do what's best for the patient, maybe they don't need surgery. Maybe they need to try physical therapy more. Maybe they need to do this more. Maybe we can try these injections. Maybe try this. Or they can have more and more surgeries because they know the surgeries are what's necessary for them to keep their pay. And so this is why you're starting to see more and more that many of the surgical specialties, I hate to say this, but many surgical specialties really push surgery really hard on a lot of patients. And it's coming to a point where, you're starting to see in the data that many of these surgical interventions are probably not good for people, but, such is life, right? And so what I find is that the entire healthcare system has essentially trapped those people who care enough to become physicians, to care enough to become nurse practitioners, to care enough to become a CRNA, to care enough to become a, whatever, any kind of, healthcare provider, a nurse. They care so much, then they get into the system, and the system is essentially designed to extract from them the absolute most they can and give them little to nothing back. And this is the problem with healthcare. And that's why the only solution is to leave the mainstream healthcare system. It has become so corrupt. It's become so burdened with, all sorts of different problems, ethical problems, moral problems, financial problems, you name it. It has become so corrupt and burdened that you have to eventually go and build your own practice. And there have been so many examples of people doing this. One example is a surgical center that is outside of Tulsa, Oklahoma, where they basically only charge cash. They don't even take insurance. But if you want to get your gallbladder out, you can go there. They will tell you up front how much it costs. And I think, I forget exactly what the cost is, but it was very reasonable. And you can actually go get your gallbladder removed, complete everything all done, ready to go, no questions asked. You just simply pay your money and you're good to go. There are getting to be more and more of situations like that, because people are starting to realize that mainstream healthcare not only delivers worse healthcare outcomes, has very, very questionable ethics on many of the things that it does. And then finally, many of the people inside the mainstream healthcare system are essentially very depressed, if not essentially incentivized to not be ethical, which I think is the reason why you have so many physician suicides. Because most people that go into medicine, what they do is they want to help people. They want to be able to offer value to someone. They want to be able to fix those who are ailing, to help those people that have difficulty. And instead, they're put into a system where they're basically put onto a treadmill and told, like, hey, run as fast as you can, treat as many people as you can. Otherwise, you're not going to be able to eat today. You're not going to be able to get your pay. And it just becomes a big mess. And so I just wanted to kind of make this video to talk about the dangers of the insurance system, and why, if you are currently someone who has their own medical practice and you are taking insurance, it's not the end of the world. There are things you can do. There's even still ways you can make money from insurance, but you really need to realize how dangerous it is for you, and how dangerous it is for your future to continue down that road, especially with inflation being so high. Because every year, even if it's only 10% inflation, closer to 15, according to most experts, according to shadowstats.com, according to most financial experts, closer to 15% inflation. But assuming it's only 10%, every year you're getting a 10% pay cut. Well, every year, all your costs are going up 10%. every year you're getting paid less, you're getting less, the money you're getting paid is less valuable. And so because of that, you're actually getting a pay cut every year. And you'd be so much better served by finding one of the many avenues to have your own cash-based medical practice where you can set your own terms, or you can set your own prices, and you can interact with people who really want to find you and who seek you out because they're looking for something different than the mainstream medical system. And those people are increasing by the hundreds and thousands every day. There are more and more people who have just said, hey, look, I don't believe in big pharma anymore. Hey, look, I don't think these guys really have my best interest at heart. Hey, look, why is it every time I go see this guy, he tells me I need surgery when another doctor tells me I don't? More and more people are starting to question these things. And so what's happening is you're seeing the loss of confidence in the healthcare system. You're seeing the loss of financial stability in the healthcare system. You're definitely seeing the loss of skilled practitioners in the healthcare system. And you're seeing more and more people who literally just leave medicine entirely because of this. So please think about 5 years from now, what would you rather have? Would you rather be still part of the system, getting paid essentially the exact same you're getting paid today, but having 5 years of inflation on top of you? Or would you rather have your own practice that you could set your price in, and with patients who are happy to pay you cash because they want that expertise, they want the extra benefit that is given to them by that. They don't want to be treated like cattle. They don't want to be herded in 5-minute visits. They don't want that. They're willing to pay a premium for the excellence that you can deliver. So love you guys. Love you, medical entrepreneurs. Stay strong. One vision, one purpose, freedom through prosperity.